it's a different environment now for patients as they seek to gain access to care. And so I would say that's probably the biggest policy change that we have had is the Affordable Care Act. So I practice in Texas, and Texas didn't expand Medicaid. But I would say that the biggest challenge that I've seen so far is individuals who would not qualify for Medicaid, so they're greater than 133% of the federal poverty level, but they have not elected to participate in the exchange program. And so in the last 2 weeks, I've actually seen 4 patients with advanced breast cancer who financially don't qualify for Medicaid, would be eligible for the exchange programs, but did not enroll, and it's not open enrollment now, so they won't have access in that way. So it's a challenge, and I think that it's been hard for, healthcare is complex, and it's hard for individuals to go in and try to understand the healthcare marketplace and make informed decisions. It also is very expensive, even though we do have subsidies from 133% to 400% of the federal poverty level, and different programs so people can choose if they want silver or bronze, what they want their deductible to be. It's still higher cost than if they just don't pay for anything and hope for the best. And so what I see, and I'm biased by the fact of where I practice, but what I see is that not enough individuals who would otherwise qualify are signing up for the exchanges that they need. And then, in Texas, we have an issue that we haven't expanded Medicaid, and so there is this large percentage of patients that remain uninsured. In Texas, that's actually 32% of adults and 24% of all Texans, even though nationally the rate's at about 12.9%.